All right, ma, I'm gonna give you some numbing medicine. It's gonna sting and burn. 1, 2, 3, pinch. Sorry. So what we're doing here right now is something called an IVC filter removal. So a lot of patients with pulmonary embolus are supposed to get just anticoagulation, but in some patients that they cannot anticoagulate, maybe they had bleeding at that time or they had surgery at the time of the clot, they can't get anticoagulation. In those cases, they will put in a device called an IVC filter, which is an umbrella basically in the inferior vena cava in the IVC. We know that IVC filters are good in the short run, but we also know that in the long run, they actually cause more problems. So the advice is that once we don't need them anymore, we should take them out. So in this case, we have an IVC retrieval kit here, which we're putting together, and we're gonna put this now in the neck to get this filter out. So right now, I'm just trying to catch one of the hooks. And I caught it there. Okay, store that. Okay, now I'm gonna pull everything out. And the filter should be right there. See that? Okay. So we've now taken out the device. You can see is this umbrella type device that sits in the inferior vena cava, and it has all of these legs here. Basically, it's got this hook which allows us to remove it. But yeah, the filter is out. It looks like it's intact, and we can go on. All right, so what we're doing today is something called a uterine fibroid embolization, which is a treatment we do for treatment of fibroids. This is an alternative to surgery in a lot of patients where we can basically block off the flow to the fibroids. We're going to get access in the radial artery here. And once we get access in that radial artery, we then put in this sheet and this catheter to treat the fibroids. Are you feeling burning in your hand? That will go away. Have she gotten around?
Yes.
Give her another round. Okay, bring the screen, please. So what we've done now is we've successfully attained access into the radial artery. We're now going to put in this long catheter. This long catheter is going to go all the way from the hand all the way to the pelvis. So now we're in the uterine artery. We've identified the uterine artery on the left side, and we're going to start the treatment. And what we're going to do is start to inject these particles. These particles are called embospheres, and they're specifically designed for this purpose. Basically, the goal of the treatment is basically to go block the capillary network of the fibroids. If we can successfully block the capillary network of the fibroids, then the fibroids don't get blood flow. If fibroids don't get blood flow, they simply have one option: to shrink and die. So we will typically treat the right, and then we'll treat the left. And once we're done, the fibroids should essentially be dead by the time the patient gets off the stable. The advantage of uterine fibroid embolization, as you can see, it's not major surgery. We're not doing any major cutting of the patient. The risk tolerance for this procedure is much better than surgery, given the fact that we're not cutting into the patient, and the recovery is much faster. Most of our patients will stay in the hospital for just one night, and then typically will go home by the next morning with pain medications.